Alright.
Alright, Rex Holden here with Physical Therapy and Balance Center, and today we're going to talk about an exercise to strengthen the outside of your hips right here. These are really good for your balance, and they're also really important when we walk or when we get up from the floor and things like that because they're big stabilizer muscles, alright? So what you're going to do is stand in front of a chair or at your kitchen counter, and you're going to take your foot and bring it out to the side. It doesn't really matter how high you're going, just take it out to the side. Try not to rotate it out like that because that works a different part of the muscle. We want to feel this part of your muscle right here in your buttocks. So point your toe in just a little bit and then move that leg out to the side. And then have a slight bend in this knee that you're standing on, just a little bit. Try not to push that knee all the way back and hyperextend it. You want to have just a slight bend in that knee. So you're going out to the side like that, okay? And as you progress, you can maybe do that, not hold on to the counter, just stand there like that and go out to the side. So at first, maybe do 5 reps to the right, 5 reps to the left. Repeat that a couple times and build yourself up to 10 to 20 reps totally on each side. Alright, so we're going to talk about hip hinges today, which is also a deadlift type of movement. And this is a very important movement pattern because we can strengthen our glutes and our hamstrings, and it can help support our knees and our ankles and our hips and our back. And if done properly, it's an excellent exercise when you're rehabbing your knees and or your ankles or your hips. So we're just going to show you a double leg hip hinge today. So you're going to stand with feet about shoulder width apart, nice and tall. And what we do on this exercise is we're going to look straight ahead, put my hands on my hips. I'm going to be looking straight ahead. I'm going to have a slight bend in my knees before I start this exercise. And that's about all the bend that I want in them. I really don't want them to bend anymore because if you do this, it becomes a squat. And we're doing a hip hinge. We're bending at the hips. So you're going to push your buttocks out toward the wall behind you and come down like that. And this should stay very straight as I do that. And then I'm going to come back up. I'm going to squeeze my glutes and move my hips forward. I'm going to come back down and then come back up. Now I could let my arms hang down like this, but sometimes what happens is when people do that, they kind of reach and they start to bend like this. And that's what we're trying to prepare you for, is not to do that. We want you to be able to stand up tall, stick your bottom out and keep that back straight as you come down. Now this is as far as I can go without bending my back. So that's my limit. That's where my hamstrings say that's as far as you can go, Rex. So that's what I'm going to do. I'm just going to go down and then back up. And I'm looking straight ahead because that helps keep my back straight. If I look down, sometimes I do that, right? So we don't want to do that. Right there is the exercise.